thinking, decision-making, problem-solving, metacognition, metacognition. What's that mean? So we're going to explore all of those terms and define them very quickly today, just as a jumping off point for the rest of the semester. But you'll notice as soon as you start reading, your textbook gets into substantial detail about some of these concepts. And that's why you must read. So let me throw this question out at you. And unfortunately, we're not in a real classroom. I'd love to pick your brains, but I'm still going to pause and ask you to really think about the questions that I ask. Why learn about thinking? Who cares? We all got brains. They're working. We're thinking all the time. Are we? Are we thinking all the time? Well, I find working in clinical practice exhausting because I am thinking all the time. And I'm oftentimes thinking, what is the worst thing that can happen to this patient? One of my latest patients that I had, I just came in the morning, and this gentleman had an esophageal varice repair, and he was in liver failure and was threatening to vomit. He just had a surgical operation on his esophagus 2 days prior. I know, I always think pathophysiology because I spent a lot of time teaching pathophysiology. I know that the liver plays a part in clotting. And if your liver is failing, you're not going to be clotting like you normally would. I also know that having surgery on an esophagus and then vomiting would put a lot of pressure on the esophagus surgical site. So that if this man started vomiting violently, he could open up one of his surgical incisions in his esophagus and wouldn't clot, and he could die. And he was only in his 30s. Oh my goodness, what a disaster that would be. So I really see, getting an order for Zofran or some other antiemetic as being imperative. Like one of the first things that I would do that day. Now, if I didn't have all that professional knowledge, that's professional knowledge that I'm talking about, that pathophysiological knowledge, I may not be as concerned. I might be that dumb bunny nurse. I'm thinking, oh, he's nauseous. Oh, that's too bad. Well, I'll get to that when I can. But I got to get all my assessments done first. So that's just an example of how important it is to be a good thinker. And some of the reasons I listed, I think better thinkers are better practitioners of nursing care. What kind of thinker are you? How much professional knowledge do you have? Better thinkers save lives. I could save that man's life because he is an experienced nurse who knows it's very important to not allow him to vomit. I could save his life. And research has shown, and I saw something about this in the first 3 chapters that you need to read this week, that when nurses are better thinkers, that they actually save lives. Nurses who have more experience, more knowledge, have better outcomes. We can all become better thinkers. We can all gain more knowledge. We can all learn questions that we should be asking. What, where, how, why, what for? Why is this happening? What don't I know about this situation? Etc. So I'm hoping that I can teach you some of these tricks as we move through this class. We'll know quite a bit about how we think and how we can think better. by the end of this 7-week session. I imagine I'll learn more myself after reading through this textbook, which I have never read before. So, just as a side, please bear with me as I work through presenting this course. I'm going to try to stay 2 weeks ahead of you, and I'll definitely have guidelines for all your assignments up front. But as far as posting information in the course, you'll just see 2 weeks ahead. So by dissecting important aspects of how we think, our awareness will be increased and our thinking will be improved. So we can reset our minds. We can become better and better. And that's kind of one of my credos is, become better and better every day. Don't stop. Don't stop learning. Okay. So clinical thinking, what the heck is that? Well, see Chapter 1. Chapter 1 refers to it as clinical reasoning. So it's really the same thing. It's defined from your text. And I didn't include references, sorry, because I'm bringing things out of your text and you're going to read it very shortly yourself. Clinical reasoning is a context-dependent way of thinking and decision-making in professional practice to make practice decisions. So it does involve critical thinking in that we're looking at the context around the data that we're collecting and we're making decisions based on it that affect our practice of nursing care. Core dimensions of clinical thinking, and each of these dimensions is defined and discussed further in your first 3 chapters. Knowledge. What kind of knowledge level do you have? What's your brain like? Is your brain in good shape? Do you have good cognition? Not if you come to work with a hangover, right? You're not getting enough sleep or you have a severe head cold. So cognition is also referred to as reflective inquiry. So in other words, reflecting. At the end of my clinical day, I say each day, especially when I'm learning on a new unit, it's like I'm starting all over again, according to Benner, as a novice. When I was working in the ER and fast track, I've never given injections to toddlers or catheterized newborn infants in my entire nursing career. And now all of a sudden I'm doing that. Or I might have a psychiatric case on an oncology unit and be taking care of bulimic. So I have to reflect, did I do the best that I could that day? What else could I have done better? And metacognition, which we'll define in a moment. So critical thinking is defined is in professional practice. We do refer to critical thinking as well. And it's intimately linked to the process of reflection. Okay, so you don't just go through the motions, you reflect on what you did. And it's defined as the intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to belief and action. If you wrote this sentence, I'd make you split it up into 2 or 3 sentences. That's a long sentence, a long definition. So that's what critical thinking is. And actually, that's what I want you to do as you post your discussion board posts. And as you complete your paper, the greater degree of critical thinking that you demonstrate, the closer to 100% grade that you're going to receive. So this man here is doing some critical thinking. You can tell he's deep in thought. Ethical thinking. by the way, this is a picture of me and my mom. And I went through a lot of ethical thinking and taking care of both of my parents as they were on a downward spiral over the last 2 years in terms of their health. There's a point where you have an ethical dilemma. So the ethical dilemma is how aggressive, every time I took them to the physician, how aggressive should we be with managing this or that clinical problem? Because literally everything goes as you get older. So ethical thinking is defined as those less recognized but frequently made decisions regarding moral, political, and economic dilemmas, which clinicians regularly confront, such as deciding how long to treat. So, with my father in particular, he kept aspirating his food, and there really wasn't much we could do about it. And he had already had a long trail of intractable pain and didn't want to live any longer. And I had to make the decision to put him on comfort care. And 2 days after I made that decision, he was gone. So it became so stressful for me as a clinician and a daughter that I developed appendicitis and had to have emergency surgery. And unfortunately, that's the day I lost him. I didn't even get to see him pass. So you'll have lots of family members, especially with having more and more people age to the point where they're actually suffering. And I know many of you have seen people begging to die. And we insist on keeping them alive. So that would be a great example of an ethical dilemma that we wrestle with. Some of you are in ICU. You know, when you take away the dopamine drip or other medications, that person will not be able to sustain their own life without that medication. And that presents an ethical dilemma. We're doing ethical thinking all of the time, and it is another source of stress for nurses. So that's something to consider as well. Another part of thinking is creative thinking. This is a way of looking at problems or situations from a fresh perspective, and it suggests unorthodox solutions that perhaps no one else has even thought of before, and sometimes it's unsettling. For example, with our ethical problem of comfort care, maybe we should take patients off their medications completely at some point. If they want to die and they're ready to end their lives, why not? Now that's unsettling, isn't it? Because it's unorthodox and it's not something that we're doing regularly yet, but it's something that I would like to explore in terms of a researcher and move towards. I think when people are ready to die, we shouldn't be working so hard to keep them alive. So that involves some creative thinking, some ethical thinking. Creative thinking can be stimulated by different processes like brainstorming. Did you ever say, let's brainstorm about this for a minute? You just throw ideas out on the table, and then somebody says, why can't we do that? Why can't we start taking people off their medications if they're ready to die, for example? Now, some of you may object to that, but that's what makes it an ethical concern. So, there's something called lateral thinking that you'll explore more in this course as well. And I got this definition of creative thinking from this internet site that I've provided. And so that's something you can explore more if you like as well. So we are going to discuss too in another unit later in the course, decision making and problem solving, which in your text is called clinical reasoning. It's the same thing. Clinical reasoning has been defined as the practice of decision making. Addition dimensions impacting thinking and decision making include mutual decision making. So there's a great emphasis in your text on working with the client in making the decision. For example, the end of life decision that I brought up. Shouldn't the patient have some input into whether their life should be continued or not? So there's something called contextual, the context of the situation, of context, the interaction of everybody involved between the decision makers and also the environment, and task impact, or the influence of the nature of the clinical problems or the task on the reasoning process. And I thought of, there might be something that you have to, maybe you have a real problem with death, for example. You can't even think about dying. Okay, so that task of trying to determine whether to extend somebody's life or not may influence your reasoning process. So there may be times where you have to bow out of a decision-making process, but certainly as nurses, we don't have that choice a lot of the time. Okay, so metacognition. I used this term earlier. This is a term that's new to me as well. It's not something we use every day. It's referred to as reflective self-awareness. Interesting. We all know some people who are very not aware of themselves. It's important as nurses to be aware of ourselves so we know how we're impacting, especially our patients. But I know nurses who have no awareness whatsoever. Could tell you stories, they're funny. But anyhow, metacognition is seen as a bridge it actually bridges knowledge and cognition. So remember, knowledge can be acquired. It's what you acquired. All this knowledge that you're getting from your nursing classes, you have to do something with your noodle up here, your cognitive processes. So how does that get mixed together up here? That's metacognition. While I was in nursing school, I took a course on medical ethics outside of the nursing department, and also on death and dying. And those two courses, you see those as fluff courses, but they greatly influence how I am and my being as a nurse. I'm very concerned about suffering and death and dying and ethical issues. And that's because I've obtained that knowledge. It's interacted with my little noodle, my cognitive processes. And that's metacognition. So metacognition enables clinicians to identify limitations in the quality of information obtained. So there are times where you don't have high quality information. And through metacognition, you're able to determine, hey, I need to know, for example, how the patient and family feel about this. It's not enough to just know this and this. I need to know how they feel. So through metacognition, we can identify when our knowledge or skills are insufficient so that we can take appropriate action. So in this class, you'll see a lot of Patricia Benner's concepts. She is a nurse theorist who has dedicated much of her life to exploring thinking in nursing and how to cultivate sound thinking in practice, how to teach people how to think. And she wrote a document called Novice to Expert, Excellence and Power in Clinical Nursing Practice. She believed that expert nurses develop over time as they move through 5 levels of development. They start out as a novice, become an advanced beginner, eventually become confident, proficient, and then expert at what they do. So I'd like you to read a little bit about her this week. And the reason being is that much of the course is based on many of the concepts that she's invented. So nurse theorists are inventors of theories that help us to understand what we're seeing in life and what we're seeing in nursing. So on page 130 of your textbook, please read through that. I didn't assign it officially, but our authors of our text talk about Benner, and they've identified these concepts as being important concepts to understanding thinking, clinical thinking, and they're called reasoning and transition, skilled know-how, response-based practice, agency or moral agency. Really, that's our moral ethical reasoning, and perceptual acuity and skill of involvement in clinical. I'm not going to define all of these. You can go to page 130 and read about them yourself and learn a lot more of them, what I can impart here. So I just wanted to bring those up to you. I've assigned an article for you to read this first week. It's called From Novice to Expert to Mentor, Shaping the Future. And I like this article because it very succinctly describes Patricia Benner's theory, or parts of it. It's much more involved than what we have here in this article. But it also talks about how we need more mentors in nursing. And so that's why it's entitled From Novice to Expert to Mentor. So many of you are mentors in the clinical setting, and I imagine that you're experts in your area of clinical nursing practice. Now, Benner does say, well, we go back to a different type of nursing practice, like I did, going into the ER or oncology, that we become a novice all over again. And that's true. But we tend to move through these phases a little bit faster because of the other nursing knowledge that we have. So anyhow, it's a very short little article. In addition, in the article, they talk about as leaders, and it's the Robert Wood Johnson Nurse Fellows Program that identifies 5 core competencies of leaders. And the first one is self-knowledge. So I wanted to bring that up because you need to develop self-knowledge about your own thinking processes. And this is a part of becoming a nurse leader. And you're transitioning into greater leadership roles when you obtain greater levels of education. So please be open as you move through this course to self-knowledge, learning about your own thinking in particular. Other qualities include having vision. Now, what is your vision for yourself? What are your goals in obtaining this degree? What do you want to do with it? You are taking a risk in coming back to college. Hopefully you're, being creative and thinking about your own personal reward and what you hope to achieve, not just an increased salary, but a greater rewarding experience and becoming more knowledgeable. And a couple other factors are interpersonal communication effectiveness and inspiration. Being able to inspire yourself and also inspire others. That is the oxygen that feeds the flame, I must say. Okay, so finally, in conclusion, please read carefully chapters 1 to 3 of your book. You will use a lot of this content for your first writing assignment. So don't just read it, digest it. Make it a part of you. Please contact me. I have my email here if you have any questions whatsoever. And especially if there's technological problems with the course, I don't know if someone doesn't tell me. So if we will run into a problem, I'm sure, here or there. And when we do, I'll post an announcement readily on our course wall and I'll fix it. So if you're having problems, please let me know. Sometimes they're your problems, sometimes they're my problems. But it's great for me to be able to tell you, I think this is your problem and you need to call the technology help group because no one else has reported this so far. This week you're going to post an introduction of yourself on the discussion board, and we'll just get to know each other. Let's have fun with this, okay? It's work, but we can have fun too. Learning should be fun, right? Okay, finally, I hope you enjoy this course, and I truly want you to be successful. If anything happens over the next 7 weeks that stands between you and success, please contact me right away and ask for an extension of any assignments that are being delayed. So, thank you, everyone. I look forward to